Early menopause. It's not something most women expect in their 30s or early 40s, but for some, it happens years, even a decade, earlier than average. Early menopause is more common than you think. Menopause is officially diagnosed when you haven't had a period for 12 consecutive months, and it typically happens between ages 45 and 55. But if this happens before age 45, it's called early menopause. And if it happens before age 40, it's known as premature menopause or primary ovarian insufficiency. This means your ovaries have either stopped working or are producing significantly less estrogen and progesterone, the key hormones that regulate menstruation, fertility, and much more. There are many potential causes, and sometimes no clear reason at all. Here are the most common. 1. Genetics. If your mother or sister went through menopause early, you may too. Family history plays a strong role. 2. Autoimmune conditions. Diseases like lupus or thyroid disorders can attack the ovaries, triggering early menopause. 3. Cancer treatments. Radiation or chemotherapy, especially near the pelvic area, can damage ovarian function. 4. Surgical removal of ovaries. A hysterectomy with removal of the ovaries causes immediate menopause, regardless of age. 5. Chromosomal or genetic conditions. Turner syndrome and Fragile X can lead to early loss of ovarian function. 6. Smoking. Women who smoke are more likely to reach menopause earlier than non-smokers. 7. Unknown causes. In many cases, early menopause just happens, and doctors can't always explain why. The symptoms of early menopause are the same as natural menopause, but can feel more intense or emotionally overwhelming when they happen earlier than expected. They include irregular or missed periods, hot flashes and night sweats, mood changes or anxiety, vaginal dryness or pain during sex, sleep problems, low libido, difficulty concentrating or brain fog, infertility or trouble getting pregnant. For some women, early menopause is diagnosed after stopping birth control and noticing that periods don't return. Health effects of early menopause. Estrogen isn't just about periods or fertility. It protects your bones, heart, brain, and more. So when menopause comes early, the long-term health risks may increase. Osteoporosis due to faster bone loss, heart disease from lower estrogen levels, memory changes, as estrogen helps support brain function, emotional impact, especially for women hoping to become pregnant. That's why early diagnosis and support are so important. If you're under 45 and notice irregular or missed periods, sudden menopausal symptoms, trouble getting pregnant, don't ignore it. Early menopause is often underdiagnosed, and the sooner you know what's going on, the sooner you can take control. Your doctor may recommend several tests, including 1. Blood tests to check hormone levels. FSH, follicle-stimulating hormone. High levels suggest your ovaries are slowing down. Estradiol, low levels may confirm declining estrogen. TSH, to rule out thyroid conditions, which can mimic menopause symptoms. 2. AMH test. This test measures your ovarian reserve, or how many viable eggs remain in your ovaries. Low AMH levels can indicate diminished ovarian function, helping confirm early or premature menopause. It's especially useful if you're still having irregular periods or are considering fertility options. 3. Other possible evaluations. Genetic testing, if early menopause runs in your family. Imaging tests to check ovarian size and function, in select cases. The AMH test won't confirm menopause by itself, but when combined with other hormone levels and symptoms, it gives a clearer picture of your reproductive health. There's no way to reverse early menopause, but there are ways to manage it, protect your health, and improve quality of life. 1. Hormone replacement therapy, HRT. This replaces missing estrogen and progesterone to relieve symptoms and reduce risks of osteoporosis or heart disease. HRT is often recommended, especially if menopause happens before age 40, unless there's a medical reason to avoid it. 2. Lifestyle support. Weight-bearing exercise to protect bones. A diet rich in calcium, vitamin D, and healthy fats. Limiting alcohol and quitting smoking. Stress-reducing practices like yoga, therapy, or journaling. 3. Supplements under medical advice. Calcium and vitamin D, omega-3s, black cohosh or evening primrose oil primrose for some symptom relief. 4. Fertility support. If pregnancy is a goal, ask about egg freezing if caught early. Early menopause can feel confusing, unfair, even isolating. But you're not alone, and you're not powerless. With the right care, community, and knowledge, you can take charge of your health, protect your future, and feel better in your body. If you found this video helpful, give it a like and subscribe for more.